Hello, welcome to our webinar. My name is May Kwong. I'm the Executive Director to the Center for Connected Health Policy. And today you're here for the California Telehealth Policy Coalition webinar, The Digital Divide and Telehealth. California Telehealth Policy Coalition is a coalition of over 100 statewide organizations and national members who are interested in advancing telehealth policy in the state of California. We provide a series of educational materials and webinars in order to inform the public more around telehealth and telehealth policy issues surrounding in the state of California and surrounding services provided to patients. For more information about the coalition, please reach out to CCHP staff, or you can go to our website at cchpca.org for more information on upcoming webinars, on information about the coalition, and also for a variety of resources we have produced. We'd like to thank today's sponsor, the California Healthcare Foundation and the Center for Connected Health Policy, for their generous support of the webinar. The objectives for today's webinar is to discuss the importance of broadband in terms of access and telehealth services and state broadband investments and the impacts on the digital divide and telehealth. We'll provide an overview of broadband legislation taking place in the state, discuss stakeholder perspectives and the impacts on patients, panelist discussions, and answering key questions. First off, we'll start with a broadband legislation overview, followed by our panelist session. We're joined today by moderator Fabiola Carrion from the National Health Law Program and speakers Marissa Kranek from the Insure the Uninsured Project, Vincent Lay from Greenlighting Institute, Jeff Neal from California State Association of Counties, and Jorge Pacheco from Community Health Partnerships. First off, I will turn things over to Amy Durbin from CCHP to give us an overview.
Thank you, May. So yes, I'm just going to give a really quick high-level overview of some of the broadband basics, as well as around broadband legislation and other developments to help guide us into our panel discussion today. So first off, as with many issues, COVID-19 highlighted both the existing importance of broadband, but also existing inequities. Impacts are across all industries, but in terms of healthcare in particular, for instance, the reason we've heard so much about the importance of audio-only telehealth is because during the pandemic, most other telehealth modalities require high-speed internet access and connected devices that many underserved communities and safety net providers do not have access to. So generally, the lack of access is related to three categories. One, the lack of affordability, both for internet generally, but also devices used to access it. Also the lack of actual infrastructure in many areas, plus the fact that even some areas with access don't have high enough speeds to have full accessibility. Then there are remaining issues related to usability and lack of understanding around using the internet and other devices. So moving to the next slide, California has made some significant investments this year to address many of these issues, and there's going to be ongoing areas of development and advocacy to make note of. So a lot of content on the slides, and I'm going to go quickly, but the slides and additional resources will be posted on the CCHP website in the coming days as well. So the major piece of broadband legislation this year passed in conjunction with the state budget was SB156. Together, $6 billion was allocated toward expanding broadband infrastructure and access in California, funding primary broadband programs, as well as updating various rules and standards around the deployment of broadband. One of the primary pieces of the bill were provisions related to middle mile broadband infrastructure, which detailed the construction of a state-owned open access middle mile broadband network to serve as the main connection between localities. So for example, to allow a smaller town to connect to a larger metropolitan area that has a larger presence of internet service providers or ISPs. Currently, middle mile networks are largely owned by ISPs that have to date not built out sufficient service to many with low populations and low income areas. So the hope is that with more access, California will gain access to high-speed internet through this middle mile network, and the open access structure might increase competition and affordability as well. The other big component of the bill and investment is focused around last mile support. So that last mile infrastructure that provides internet directly to homes or offices in currently underserved areas. So $2 billion in particular is allocated for those, and additional parameters around eligibility and definitions were updated as part of those provisions of the bill as well. For instance, the bill updated the minimum broadband speeds to try to ensure both the broadband and high-speed aspects. The bill also created a loan loss reserve to help local governments and nonprofits access funding for broadband projects and encourage loans and support for other costs, since obtaining needed capital has been a barrier to those networks as well. So on the next slide, just want to give a few other updates regarding different regulatory entities in this space. The California Broadband Council and CPUC, which has been working on the middle mile network build out, locations and project prioritizations. Then 2 new entities that came out of the SB156 middle mile components, the advisory committee that has published an initial proposal for the middle network and will continue overseeing those efforts, as well as the new California Office of Broadband and Digital Literacy. So next slide, just wanted to cover, there were quite a few broadband bills this year. This slide shows the ones that the legislature passed and sent to the governor. Yesterday, actually, the governor signed AB 537 and vetoed SB 556. So the SB 56 veto message spoke to potential conflicts with future FCCC changes. Referred back to SB 156 as well, mentioning the achievements from that bill related to encouraging and enabling local governments to increase broadband access, and how the governor looks forward to future discussions on those collective efforts with the legislature. But AB14 and Sb4 were a couple of the main bills around the issue, so just wanted to briefly touch on those. They focused around the existing California Advanced Services Fund, which is administered by the CPUC, and one account specific to funding broadband infrastructure deployment in unserved areas that's funded through surcharges. So the bills made revisions to that account, surcharge collection methodologies, increased the annual funding cap, and expanded projects eligible for those grants. So more long-term broadband funding sources, and the governor has until October 10th to sign and veto the remaining legislation before him. And lastly, we have a slide just with additional resources on broadband and telehealth policy. And with that, I will hand it back over to May.
Thank you, Amy. And just to let you know, the slides and a recording of this webinar will be made available a couple of days after the webinar. Additionally, if you have a question for any of our speakers and the panelists, please put it in the Q&A function. The chat function, we're trying to leave that only if you are having technical issues. So questions for our panelists and our moderator, please put into the Q&A function. Next, I would like to introduce Fabiola Carrion, who is the Interim Director, Reproductive and Sexual Health at the National Health Law Programs Los Angeles office, where she works on reproductive and sexual health access and services in California and across the country. Her portfolio focuses on abortion coverage at the state level, primarily in Medicaid and the marketplaces. Fabiola also coordinates and helps groundbreaking work on telehealth by ensuring that Medicaid enrollees are centered in emerging telehealth policies. And I will now turn it over to Fabiola.
Thank you, May, and good afternoon, everyone. My name is Fabiola Carrion, and like May said, I'm the Interim Director of Reproductive and Sexual Health at the National Health Law Program. For those of you who don't know us, we are a public interest law firm that protects and expands the health rights of low-income and underserved individuals. We're also members of the California Telehealth Policy Coalition. Just as NHELP advocates for universal health care, we advocate for universal broadband access. In 2019, we started working on a list of telehealth principles on Medicaid, which we released in April of 2020 at the height of the pandemic. In that document and those that followed, we made the unequivocal call for investments in broadband connectivity. I am honored to be here to moderate this panel after being involved in broadband policy 12 years ago as President Obama was developing the National Broadband Plan. Back then, we knew that access to high-speed internet or broadband was a human right. Back then, our hope was that the internet would become as ubiquitous as potable water and electricity is today. We didn't exaggerate, and the COVID-19 pandemic has proved us right, that the internet is critical for our lives, for work, to look for work, for education, to engage in civic duties, and yes, for our health. Broadband must be accessible, affordable, and equitable. Broadband should not be just available for the wealthy. In fact, people with low incomes need it the most. Broadband allows for better access to unserved and underserved communities, those served by Medi-Cal and people of color. We know that throughout the COVID-19 pandemic, telehealth has become critical for maintaining access to healthcare. Nearly 22% of Californians are unconnected or underconnected to the internet, usually because internet access simply costs too much for too many families. The disparities in broadband access are clear. 79% of Latinx households and 81% of Black households have broadband subscriptions, compared to the statewide average of 84%. Broadband subscription rates are also lower among adults 65 and older, as well as among rural, low-income, and less educated households. In fact, the Green Line Institute mapped out internet accessibility throughout California and found that areas that were redlined by banks in the past have also been digitally redlined today by internet service providers. Internet service providers in California invest millions deploying next generation high-speed internet networks in wealthy neighborhoods while ignoring low-income communities of color. So with that, as I'm sure all of you are, I cannot wait to hear from the speakers in this panel to talk to us about the work that they have been doing. First, I will introduce Marissa Kraynak. She is the Director of Health Policy Research at the Insure the Uninsured Project. She oversees the planning and execution of her organization's policy research, analysis, and communication across health policy topics, including telehealth and broadband. We'll also hear from Vincent Lay, who is the legal counsel of the Green Line Institute Economic Equity Team, where he leads the organization's work to close the digital divide, protect consumer privacy, ensure algorithms are fair, and that technology builds economic opportunity for communities of color. We will also hear from Jeff Neal, who is the legislative representative for the California State Association of Counties, and who is working on a variety of issues, including broadband governance, state and local finances, and elections. And last but not least, we'll hear from Jorge Pacheco, who is the digital equity specialist with Community Health Partnership, which has the objective of closing the digital divide for Santa Clara County. And so with that, I'll start this panel by asking a very broad question. We heard about SB 156. Now I would love for each of the panelists, starting with Marissa and going on alphabetical order, if you could please tell us now what is the impact of that your organization has identified in telehealth and or broadband on their constituents, their engagement on SB 156 and other legislation, some of which we've heard before, and what it means to move for the digital divide in California to move forward. Marissa?
Thanks, Fabiola, for that introduction and for moderating our conversation today. As Fabiola mentioned, my name is Marissa Kraynak. I'm the Director of Health Policy Research with Insure the Uninsured Project, also known as ITEP. So ITEP is a 25-year-old nonprofit health policy institute that conducts research, provides easy-to-read publications on a range of health policy topics and for a variety of audiences, and hosts convenings across the state around health and health-related topics. Each year, ITEP hosts 10 local, regional, and local working groups across the state to hear from our partners working directly with and in communities to improve access and quality of healthcare. In 2020, no surprise, our working group topic was COVID-19 response and how the pandemic was impacting the local health delivery systems. A topic that repeatedly came up across the state, also not surprising, was telehealth and how telehealth flexibilities afforded by the pandemic were transformative for many. However, a big caveat that was cited from our partners across the state from all regions was for many patients, providers, and healthcare facilities was the lack of sufficient, reliable, and affordable broadband and connectivity. And that was the #1 major barrier preventing folks from accessing healthcare in a time when telehealth was either the safest way to access care, or at some points in the pandemic, we've heard the only way to access care. Hearing these stories and the impact the digital divide has had, particularly during the pandemic, on exacerbating systemic barriers to healthcare, ITUP has become more involved in broadband for health work. Being a longstanding health policy organization and admittedly not the experts on the technical nuances of broadband, we teamed up with experts to get the landscape of broadband policy and to start developing educational tools to aid our partners, our network of health partners, in engaging on broadband, and particularly the investments made by the state. Among other work and involvement with coalitions like the Telehealth Policy Coalition and Broadband Policy Coalition, ITUP has become a part of a digital equity initiative organized by the California Community Foundation to be a representative for the healthcare sector in bringing awareness to and expanding engagement of healthcare in digital equity and broadband implementation conversations. ITUP has a deep expertise of both the legislative and budget processes, and we serve as a resource for navigating these processes and helping our partners meaningfully engage at the state level to help meet the unique needs of their communities. Moving forward, ITUP continues to engage on both a local and state level in conversations around the implementation of SB 156, and to be a translator between the health and broadband worlds. Current and future healthcare innovations such as telehealth, remote patient monitoring, data sharing, data exchange, and others are use cases for broader adoption of appropriate broadband and connectivity. So I look forward to the discussion today.
Thank you, Marissa. And then I'm going to turn it over to Vincent, if you can answer the same question, please.
Yeah, is my video working? Okay, all right, perfect. Yeah, so my name is Vincent Lay. I'm legal counsel at the Greenlining Institute, based out of here in Oakland. So the Greenlining, we are a racial equity nonprofit focused on, eliminating the practice of redlining done by banks in the past, where they wouldn't loan to communities of color, and then now happening over and over again by private companies like internet service providers who aren't investing in low-income communities, aren't investing in rural communities, and then making sure that those communities have a disadvantage when it comes to getting economic opportunity. So that's why we work on the broadband issue and on the digital divide. I've been working on that for over the past 10 years. And I'm going to be honest, right? Before SB 156, when I worked at Greenlining, there wasn't a lot of action on broadband, right? We ran bills, over and over and over again, but the pandemic really showed, California and really the rest of the world that internet's not just a luxury. It's definitely a utility. And at the beginning of the pandemic, we released a report kind of showing what life is like without internet access for low-income folks, to help convince people in Sacramento and other supporters, potential supporters of SB 156, that we do really need prompt action and massive action on this. And we're really happy that we got it with SB 156. And the focus on broadband, not just here in California, but federally. So we're really excited. What it means for communities of color for us is going to be more houses, more public housing, connected to the internet, more free internet for those residents, more cities and municipalities that have been ignored by internet service providers getting fast broadband that allows Californians to compete at the highest level. And finally, I hope, really hope that the end result of this is that, for communities of color, we can close that digital divide and then catch up where everyone has connectivity. So I'll leave it at that. Thank you, Fabiola.
Thank you, Vincent. And Jeff, would you mind answering the question as well?
Sure. Thanks, Fabiola. I appreciate being here today and having the opportunity to make some comments. Our members, I represent, of course, all the counties in the state, California State Association of Counties, and our Our members are the county supervisors, as well as the rest of the county government. And our members, especially in rural areas, of course, have been talking about broadband for years, how to get it to the areas that don't have it, because many of them, they obviously live in the county. Each of them represents a different part of the county. And many of them, it's not just their constituents who have broadband issues, it is they themselves who have been unconnected to broadband. And so while we've been hearing it from our rural members for years, we have, in fact, just before the pandemic, and then certainly more so during it, heard about it more from, we were hearing about it more and more from our urban and supervisors and those from mid-sized areas. And then, of course, during the pandemic, we were really led by Supervisor Alejo in Monterey County. Of course, there was the picture of the school children outside a fast food restaurant in his district in Salinas. And he was already active in the area, and he just took that on and started rousing the troops. He didn't have to do a lot of rousing. Like I said, a lot of folks were already talking about it, but it really turned the corner. Unfortunately, we had the governor, by executive order in 2020, asked for the California Broadband Council to put together a guide for how to get broadband to everyone, the Broadband for All action plan, to come up with an action plan. And so we were, involved just as a commenter in that process. We have a formal role in it, and their plan that came out, the Broadband for All action plan, it states it very simply in the I think it's the first sentence of the foreword. Broadband is necessary for modern life. It's not just about education. It's not just about business opportunity. It's not just about telehealth, obviously an important thing. It's just necessary for everything. And, I think it was important for them to say that so plainly, because we've been running into for years, as we talk about this stuff, why should the government spend all this money so that people can watch Netflix? Why should we do it when we know that people use it for frivolous purposes? And, the answer, there are a lot of answers, but one of them is we don't say electricity isn't important just because some of the things people use it for aren't the highest and best use. It's just that electricity makes all of these things possible. Telephones and having everybody connected make all of these things possible. So one of the things in that Broadband for All action plan, sort of buried at the back, the CPUC, the Public Utilities Commission, had run an estimate, or had commissioned an estimate for how much it would cost to hardwire 100 megabit per second broadband to every home and business in the state, every structure in the state. And the estimate came in at around $6 billion, give or take a few hundred million. And we saw that. We'd put together a working group of county supervisors. We saw that, we thought $6 billion, and we could have 100 megabit per second broadband everywhere. And so we decided to ask the state for $8 billion, $6 billion or six and a half roughly for the infrastructure, and then a little over $1 billion for all these affordability and digital education, all the things so that people can actually access it. And so I think the governor already had a similar idea, but we were pushing for billions of dollars of broadband funding. It was one of our association's highest priorities this year. From early in the year, of course, $6 billion ended up getting approved. We didn't quite get the affordability piece that we were looking for, making broadband more affordable for folks. But we'll keep working on that into the future. But I think this is really critical, not just for the people who live in counties, which is everyone, but it also improves access to government services. Whether that's healthcare, which of course, counties provide and other governments provide, whether that's access to the human services that are, critical to keeping people out of poverty, whether it's access to just government meetings, watching government meetings and seeing what's going on. All of those things are an important piece of it. So that's why it was such a big priority for us this year, and why we were so active on the issue.
Thank you, Jeff. Glad that you were very active on this issue. And last but not least, Jorge, can you introduce yourself, please?
Hi, everybody. I'm Jorge Pacheco Jr. I'm the Digital Equity Specialist with the Community Health Partnership, which is a consortia of 10 community health centers in Santa Clara County and San Mateo County. So the question is the impact of telehealth and or broadband on our own constituents, right? So a lot of people don't know this about me, but I was a teacher for the last 8 years, and that was my entire career since graduating from college. But and last year was my, the last school year was my last year in the classroom, and I left that career of 8 years because of what I saw was the impact of broadband on not just my own students, but their families and their parents, and their families and their parents were also the main constituents of our community health clinics. And what we saw were families that had no idea how to use broadband, how to access broadband, or were paying exorbitantly high prices for broadband, literally deciding between groceries and internet, between their livelihoods and their children being able to access online learning, or themselves being able to access telehealth. The world completely shifted overnight, and community health centers had to adapt to this, to these changes within a matter of weeks. And so what we saw was that, and this is the reason why I'm now in this position, is that this impact that we saw on kids and on families and on communities of color, our low-income neighbors, that had life and death implications. That had long-term impacts that I fear some kids may never be able to pull themselves out of the holes that they were buried in because of lack of broadband. That isn't their fault. Or how many families lost their members of their how many families lost people in their own families, due to COVID or due to unmanaged chronic conditions, because they didn't have access to information online, or they didn't have access to their doctors for lack of digital literacy or acceptable devices. So this is all to say is that we believe that broadband, high-speed, reliable, and affordable broadband is a human right. And if it is a human right, that means it must be treated as a utility, as someone else said earlier. So what does that look like in terms of policy, in terms of programming, and why are we getting involved in this fight as a community health center consortia? And the reason is because public health depends on broadband, and broadband depends on public health. And that's why we're trying to create the first last mile public broadband network in Santa Clara County. Currently, and correct me if I'm wrong, Jeff, but I don't believe a single county has done this yet. But counties are now starting to get into the conversation on what does that look like? What does it look like for broadband JPAs to manage last mile public broadband networks? What does it look like for these networks to serve in our most rural areas, in our most impoverished areas, and in our areas where our community health centers are located? And what does this mean when it comes to competing with incumbent ISPs, which currently dominate this industry, which monopolize our areas? What does it mean to go against that multi-billion-dollar industry while we ourselves are just trying to create a local option for our most high needs people? So that's the reason why we're trying to do what we're doing. And there is no roadmap. We're trying to create something that hasn't been done before, and which is very daunting, but at the same time, someone needs to do it. They need to be the first. We're really happy that Monterey County is leading the way by convening a broadband task force to determine what type of GPA they want to move forward with as they determine their last mile public broadband networks. And Santa Clara County is trying to also move in the same direction. And so we're really excited to be here, and we're trying to mobilize and create a grassroots movement to make this the normality, to make sure that nobody gets left behind, and that people and everybody see that broadband is a human right and thus must be treated as a utility.
Wonderful. What a beautiful testimony, Jorge. Thank you so much. In fact, the world has shifted, and broadband is really a matter of life and death. I'm very much thinking about the kid outside of the McDonald's doing their homework, as the daughter of a first grader of a teacher that teaches first grade. Definitely have seen personally how important broadband has been both for my mom as well as for her kids. I want to pick up on something that Vincent said, which is that not a lot of broadband of action in broadband was done. However, we just enacted SB 156. I'm wondering if each of you can talk a little bit more about how big of a deal SB 156 is, and can you put it into a broader context what these developments mean? And I'm going to pick on someone, Marissa, if you want to go first, that will be great.
Sure, thanks, Fabiola. I mean, this is the largest investment in broadband in the country, as far as I understand. And so, I mean, I think this is huge because at a time when you know, we're in the midst of a pandemic where we're having this conversation online. We're getting our healthcare online. Education is at least in some part online. At some point, it was all online. There's a real pressing need for closing the digital equity gap. And this investment is really an opportunity to remove a persistent barrier to better healthcare, healthier communities, economic mobility, educational opportunities, and more for Californians. So I think this is really a moment, and it's a chance for finding solutions to close the digital divide.
Vincent, do you want to take this question as well, please?
Yeah, you know, I touched on a little bit of why SB 156 was such a big deal, but maybe for some historical context, you know, how California approached broadband was so different prior to last year and this year, right? You know, a couple of years ago, we worked on a bill where we had to fight to get $50 million a year to fund CASF, you know, that broadband program that's now getting billions. So we were fighting to get $50 million a year over 10 years. We were fighting over $20 million to get people connected to know about, you know, affordable broadband programs and things like that. And here we have a $6 billion investment. So just to put that into context, you know, that translates to a lot more interest, a lot more legislative, a lot of legislative folks, you know, that are going to support this, and that comes from the people in California that support this. So I do think, you know, that the landscape has changed quite a bit. But beyond that, right, you know, the speed limits have increased quite a bit for the California Advanced Services Fund, where the money is going to be funding 100 megabit internet. Before that was 25. We were spending state dollars to invest in internet that was obsolete the moment that California paid for it. And then, you know, now we are getting speeds that are at least 100 megabits where possible. So, you know, that's quite a big difference. So in terms of, you know, the impact of SB 156, it's what we've been asking for years. And then, you know, we finally got almost all of it. So, you know, from a broadband perspective, someone who's been doing this for a long time, I think is really encouraging. And, you know, really it's up to us to make sure that we implement it in a way that it lives up to all the promise and investment that we're making.
If I could add something, I think that one piece of SB 156 was both particularly difficult to get past, but also will have an outsized impact. And that's the middle mile piece. And, you know, I don't want to for any of our sakes, get too deep into a broadband terminology or acronyms, but you know, the fact that we as Vincent said, you know, everything he said was exactly right, and having the $2 billion in the CASF program is just going to be transformative. Plus, assuming that SB4 and Ab14 get signed, that will both expand the annual amount that goes into the CASF program, and it will extend it for another decade. And all of the smaller programs that are in that as well. But of course, the main purpose or the main impact is on the last mile pieces. But in the governor's plan that ended up being in SB 156, there's $3.25 billion, as you said at the beginning, Fabiola, for a statewide middle mile network. And this part is, I think, going to if it's done the way that we've all envisioned it happening, it's going to not only connect folks who have previously been unconnected, but it's going to there's something that I didn't know before the last couple of years. Almost half of the people in the state, even the people that have broadband, only have one provider to choose from at least at relevant speeds, right? Maybe they have another provider that offers inadequate speeds, especially if you have multiple people working or doing school or trying to go to hospital appointments from home. And so this middle mile piece of it's statewide. It's going to be a parallel network. And not only will it make it faster and cheaper to build last mile networks in the places where there aren't any right now, but all of these areas that only have one provider, it's usually AT&T, for their broadband, they're now, it won't immediately give everybody a second option, but it'll make the economies make so much more sense for a second or a third provider to also enter those same markets, because it takes away this huge expense of not only building the middle mile, but then also building the last mile into these areas. So I think that's one piece that I think frankly wasn't anticipated before the debate started this year. This isn't something we were talking about doing 5 years ago. It's really a new piece, and I think has a lot of potential to make a big difference, not just to people in unserved areas, but everybody in the state.
Thank you. Jorge, I'm going to turn it over to you. I'm sure you know that a lot of the people who are attending this call are healthcare providers or represent healthcare systems. What is the advice that you would offer healthcare providers and telehealth advocates in the broadband policy space? What role can they play in future developments? What is the way that you work with the county, you work with multiple stakeholders? What are the things that people with different interests representing different constituencies can do to advance progressive, good, universal broadband?
Yeah, so healthcare facilities, community health centers, hospitals, those are considered anchor institutions, which means that those are eligible facilities and organizations that can take action and access funds that can be used to invest in broadband infrastructure. Broadband infrastructure is incredibly and notoriously expensive. It's probably one of the biggest barriers as to why public broadband isn't as a large and viable option for many areas and geographies across the state. And oftentimes, hospitals and community health centers, they focus so much on trying to serve their patients. But what we're trying to do is also have everybody understand that you can partner with your county, with your city, and create JPAs, joint power authorities, and collectively access CASF grant accounts, funds, where you can invest and create public broadband networks or even community Wi-Fi programs that we see replicated across many municipalities in the state, most notably San Bruno, Santa Monica, San Leandro. And we also see a lot of counties getting together and doing the same thing. And so what oftentimes people don't know, though, is that your everyday hospital, community health center, they can do the same. And oftentimes these are the places that are going to be most prioritized when it comes to this type of funding, especially the last mile infrastructure. So we actually see a lot of success stories in the Bay Area where a community health center partners with a local ISP, not one of those large monopolizing ones, but a local ISP, and creates a broadband network for not only the surrounding community, but all of the patients at incredibly subsidized prices, or if not free. So those are some options, though I do want to caution and let people know that because broadband is so expensive, and which is why SB 156 is such a revolutionary piece of legislation that is not only going to energize the public broadband movement in the state, but it's also going to help give those necessary funds that your local hospital, community health center, a school district, a county office of education, or any public agency that they can use to invest in these types of things. Community Wi-Fi programs are oftentimes also funded primarily by bonds, which makes them unsustainable in the long term. They're great, but what we have to think about, though, is how can we create revenue generating options that will create affordable broadband prices for our local communities. So those are the kind of infrastructural long-term things that we need to start thinking about, that community Wi-Fi bond-funded programs will not be able to solve on their own. So those are just some ideas.
Those are brilliant ideas. It really hones in the point that providers not only can offer telehealth services and advocate for telehealth services, but be an active player in making sure that as many people stay connected. So that's really interesting. Thank you, Jorge. Marissa, I'm gonna, this next question is for you. As you know very well, there's this question about audio only, right? And the fact that a lot of individuals don't have access to broadband services and have had to rely on telephone only services in order to speak with their providers. Can you give us any thoughts around different telehealth modalities in connection to the digital divide? For example, efforts to keep audio only coverage until broadband access is equitable.
Thanks, Fabiola. I think it's definitely true that the digital divide has a big impact on why audio only telehealth was so well received and used during the pandemic. I mean, we've heard stories from, from families having only one school-owned computer for their entire family, and having the ability to take their healthcare needs by phone was transformative. Many other different stories about accessible for those with digital literacy concerns and barriers. But I think with the modalities, the audio, offering audio only is an opportunity among all the other different modalities that are possible, permit Californians to get their care when they want it and they need it, how they want it and they need it, and in the manner that they prefer and that they're most comfortable with, which ultimately is really it's necessary for addressing health equity and making sure that telehealth remains a way for the healthcare delivery system to be accessible to everyone, and to be a tool in the toolbox of healthcare delivery. You need to have all of those different flexibilities in place.
I appreciate that. Yeah, definitely we can fight to maintain audio only while we are advocating for universal broadband access. Vincent and Jeff, this question is for you. So we got SB 156. It looks like we are at a critical point in terms of policy. We were able to achieve this. There are some really interesting initiatives like the one that Jorge described. So what's next, right? What comes in 2022 and afterwards, both at the state level and through the legislature and the administration, as well as the federal level? Vincent, you want to get us started?
Yeah, sure. We at Greenlining also work on a little bit on the federal legislation that's been going around broadband. We were part of the FCC for a while. What I see is, in the federal infrastructure bill, right, there's going to be a lot more focus on infrastructure. So a lot of projects in California, they'll get money from California CASF. They'll also get money from the federal Rural Digital Opportunity Fund and other funds that are available. So I think there's going to be even more infrastructure money. I think there's finally, we care about it as a country. I think there's going to be what SB 156 didn't have was money for outreach, right? We have a lot of available funding. They can go to states, it can go to counties. There's like federal funds for affordable and free broadband, but that's not trickling down to the community. They don't know about it. They don't trust it. They don't want to sign up for it. So a lot of resources are available, but not being used. So there's actually going to be some more funding, at least $100 million per state. States can ask for more to get funding to give the local organizations, cities, schools, whatever, to get that word out, get people actually signed up, saving $30 to $50 a month on the internet. And then the last thing that I'll probably say is, we're looking at the FCC to get another commissioner so we can get some action on, broadband policy. And I also think there's going to be some action around, how we fund public programs like Lifeline, like the emergency broadband benefit, going long term. Right now, it's, they borrowed money, they're appropriating money to pay for it. But do we want to keep doing this long term? Do we want to subsidize the providers, or do we want to keep building more infrastructures so the internet service providers have to compete with each other and then lower the prices that way? So I think we'll find out, but I think in the short term, we're going to see a lot more building and then a lot more outreach in federally and in California.
Yeah, I agree that with everything Vincent said. Certainly the federal piece is important. The infrastructure bill that's pending has a lot of money, and if the American Rescue Plan Act hadn't passed, that's where, frankly, a lot of the money that California's, all the $6 billion we're talking about, essentially all of that is federal money. It was one of the allowed uses. Now it's also, counties and cities got American Rescue Plan Act dollars, and there are certain allowed uses. Some of them are fairly broad, some of them are fairly specific, but there are a few counties that I know of that are allocating some of that funding for this purpose. I know that, as Jorge said, Santa Clara County is working on doing that. I know Nevada County, over in the kind of northeast of Sacramento here is doing that. A few others as well, and that's one of the things that we have going forward. There is money at the CPUC in the CASF fund for assistance, for sort of, I guess, technological assistance or assistance in getting the money, and so that should help communities that don't have an army of grant writers or haven't done this before. And one of the things that I think we mentioned, but goes along with what Jorge was saying in his previous answer, in his previous comments, are that some of the reforms that were in SB, we're talking about the money, but there were reforms that some of us have been advocating for years that finally made it in SB 156, and one of those was evening the playing field for the CASF dollars, for these last mile dollars. It was always that the ISPs had the first call on it. And in fact, they had a lot of authority to basically block other applicants by just saying a magic word, if you will, or filing a magic document. And they could block folks from getting that money and sort of keeping it for themselves. And most of that is done now. So both local governments, but also nonprofits have more and small providers have more access to that. I think the one other piece I'll mention, and Vincent mentioned that the EBB program, but some sort of affordability. Even if we get prices down so that it's more affordable, there will always be, just like there is for electricity, just like there is for telephone, just like there is for every other thing that we consider a utility, there will always be some folks that need, some households that need help affording the broadband service. And so having a state program to do that is something that we will continue to advocate for. It was something that was originally in the proposal that ended up becoming SB 156, and I think is the major piece that's still outstanding. So that'll go in next year, hopefully, or in the years to come.
Yeah, I just want to quickly add, California subsidizes up to $14.25 a month for Lifeline phone service. You can get it with broadband, but I think what Jeff said was saying is, like, why don't we expand that to just pay for broadband for folks? I think for California side, really fixing those rules would be a big change, and that'd be something that'd be welcomed.
Yeah, I completely agree. So my organization works with Medicaid recipients, and a lot of them, or with Medicaid recipients, and a lot of them are also recipients of the Lifeline program. The problem is that they don't get enough minutes to cover all of the things that they need to cover in terms of the healthcare service. So definitely more investment needs to happen. And I'm really glad that you raised the point about the need for outreach. So there's a lot more to be done. And starting with Marissa, what are your organizations doing now to continue the work on universal broadband access?
Thanks, Fabiola. It's for ITUP, we're continuing to engage on giving public comment at the Middle Mile Advisory Committee meetings and in the CPUC rulemaking processes. Which is it's really neat because it's a really good way to actionably engage with the CPUC to help them to give sort of a healthcare voice and perspective in some of those proceedings, which is a perspective that I don't know that they hear from, and they want to hear the stories of how this all connects, and so we've been engaging on that front. We've also, to the conversation that was just happening as well, is sort of this need for outreach as part of the healthcare system. I don't know that there's always an intake or a discharge question that, you know, asked about connectivity for patients, and making that part of sort of the data collection for making sure that if someone, you know, can benefit from a telehealth follow-up, they and they don't have connectivity, maybe getting them enrolled in the Lifeline program or other supports and services that could be. I think the healthcare system can be kind of leveraged in that way to connect folks to the programs and services and do the outreach on broadband and connectivity and so on. So yeah, so we're going to continue. We're also working with broadband advocates, education advocates to kind of continue to have these conversations and pool folks together to continue to engage on this.
Thank you, Marissa. Jorge, anything that you, I mean, obviously, other than launching a county initiated broadband program, is there anything else that you and or the stakeholders that you're working with are doing to address the digital divide?
So I think the next thing we're going to be doing, other than everything that Marisa already described, you know, we're involved at the Middle Mile Advisory Committee. We're present at the California Broadband Council meetings. We're a party to the broadband proceedings at the PUC level, and we're submitting comments and we're replying to comments. And but besides that, what we're trying to do at the grassroots level is identify all of our nonprofit leaders, all of our public agencies, all of the city council members, the county supervisors, to the school board trustees, the superintendents, teachers, parents, and more importantly, the people that are the most hardest to reach, that will probably never be present in these types of webinars, and that is the people that don't have the broadband, the people that don't know how to access these Zoom meetings, that don't know how to navigate the digital age that we find ourselves in. Those are the people that we're fighting for, and those are the people that we need to go knock doors for and find and bring to these meetings, to these advocacy opportunities, and enable them to join our coalition, our grassroots coalition that we're going to utilize and mobilize to convince our county board of supervisors to take action on this. And so those are going to be the things that we're going to be working on over the next few months, and hopefully it lands us with a broadband JPA that concludes at the last mile broadband network for our most underserved and unserved parts of our county.
Vincent?
Yeah, thanks for asking this. I get to brag a little bit. You know, we're working at CPUC. We're part of the Middle Mile, comment period right now. I'm doing the rulemaking, but I'm really proud of our local Oakland work that we've done. Kind of addressing that outreach gap that I mentioned earlier. So we partnered with the city of Oakland to essentially give grants to 10 local community-based organizations that don't do any broadband work. Right, they do direct services. So it's when there's a church, there's El Tapano who works with immigrant healthcare workers, immigrant food service workers. We have healthcare workers. We have senior centers. So we have 10 different organizations doing different things, working with different populations. And what they're doing is we're training them around EBB, around Lifeline, how to sign up, how to qualify, how to get people involved and to do that outreach. And then they are, taking that training and turning it into a culturally competent, different set of events, right? They're either working with their direct services, they're doing, cultural events in Oakland, but they're all approaching this education and outreach piece in ways that work well for their community. We're providing kind of the support because it's really new. That type of work is really new for them. And also the recruiting, each organization is recruiting Oaklanders that don't know how to use the internet. Kind of like what Jorge was saying, they don't know how to use Zoom, they don't know how to use Google Suite. We're giving them free laptops, and then we're also giving them a 6-week course on how to do digital literacy. So how to use the internet and stuff like that. So the real goal there is, to actually close the digital divide in Oakland, make sure that people have access to all of these resources that are coming out now. And then just so happened while we were working on that, they're like, hey, do you know anything about the CPUC rulemaking? And I was like, well, yeah, actually, I do that for a living. So we're getting, the city of Oakland actually submitted maps showing what streets they need fiber on, where they could use this open access middle mile to serve their community Wi-Fi network. So a lot of great stuff's happening. And then we're trying to figure out how to bring this to other cities. We're talking to the city of Hayward soon. But we want cities and counties to get involved to really close this gap. So thanks for asking.
Sure. Jeff?
Like some of the others, we've been at least selectively involved in the CPUC's regulatory process, which can be daunting, but that's what we're here for. A little more legalistic than the legislature's process, but I guess it's just what you're used to, right? And that's an important thing. And seeing the filings by the other groups here, and it's important to keep these concerns front and center, because while SB 156 passed, despite some objections from some folks in the industry, and we're hoping that some of the other bills, Ab14, Sb4 pass over some objections from folks in the industry. Another bill, SB 28, that would require some more, or at least allow the CPUC to collect more information about voluntary low-income broadband programs that some of the providers provide. Just because the bills passed doesn't mean they're going to be implemented the way that we all thought they were going to be when we were advocating for them to pass. And so that's the process that we're going through now. We've had a couple of seminars for our members, county supervisors, but also other folks at counties and planning departments, public works departments, economic development folks, about how, what to expect with these bills passing. And we'll continue to do that education work over the coming months. Making sure people know which pots of money are out there, both from the federal government, state level, and what they can do with it, and making sure that they're thinking about some of the questions that the other panelists here have been bringing up, and not just let's get it where it isn't already, which is certainly a good thing, but also some of the other questions that pop up once you start doing it. And so we'll continue doing that education work with our folks, as well as, like you said earlier, trying to keep advocating for the affordability piece, and making sure that the gains that we've won this year aren't eroded.
Thank you, Jeff. And one last question to whoever wants to answer this. You already offered examples of what your organizations are doing. Obviously, a lot of people who are here are interested in this. Many of them don't know so much about broadband policy. Any last minute pieces of advice in terms of how is it that the organizations that are here, the individuals who are here, can help to address the digital divide? To anyone who wants to answer.
I'll just make a quick plug. I am on the California Teleconnect Administrative Committee. It provides, pretty much free or reduced price access to the internet if you are a health organization or other type of eligible entity. So if you guys are paying too much for internet, and you can just go to the California website, apply, and then there's federal and state funds that will just take care of your fiber bill. So invite you all to check that out.
All right, well, thank you so much to each of you for this very interesting discussion. Hopefully we will continue it. I'm looking forward to hearing how each of your projects go. And with that, I'm gonna hit it back, pass the mic back to May to wrap us up. Thank you.
Thank you, Fabiola, and thank you to our fabulous panelists. So just very quickly, again, thank you to Fabiola Carrion for moderating, and our panelists, Marissa Karnak from the Insure the Uninsured Project, Vincent Lay from Greenlighting Institute, Jeff Neal from the California State Association of Counties, and Jorge Pacheco from Community Health Partnership. Just upcoming events for the Telehealth Policy Coalition. We have our annual meeting on November 2nd. We are also holding a policy briefing next Friday on October 15th to talk about the future of telehealth policy in California. Again, we'd like to thank our sponsors for today, California Healthcare Foundation and the Center for Connected Health Policy. Again, if you would like more information on the coalition, please reach out to CCHP. Once again, thank you to our fabulous panelists, our fabulous moderator, and thank you to all of our attendees who attended today's session. Have a great day and stay safe.